Italy has recorded the highest one-day official coronavirus death toll since the first case was detected in China late last year. On Wednesday, the country reported 475 new deaths from COVID-19, just a day after it looked like Italian coronavirus infections had started to slow. Italy's Civil Protection Agency announced 4,207 new cases of COVID-19 today, bringing the total up from 31,506 to 35,713. Today's news comes amid hopes the Italian lockdown had slowed the spread of the pandemic. The previous record high of 368 deaths was also recorded in Italy, on Sunday. Today's figures mean the number of people in Italy to be infected rests at 35,713. Of those, 4,025 patients have recovered and 2,978 have died. The main thing is, do not give up, Italian National Institute of Health Chief Silvio Brusaferro said in a nationally televised press conference. It will take a few days before we see the benefits of containment measures, said Brusaferro. We must maintain these measures to see their effect, and above all to protect the most vulnerable. Italian coronavirus infections had slowed in recent days after the country took drastic quarantine measures to stop the spread of the pathogen. The number of daily cases in Italy was fairly stagnant at the start of this week, settling down at around 3,500 new patients per day. Tuesday's increase in the overall tally was 12.6%. The second lowest rate since the virus began spreading in Italy on February 21, offering hope that the lockdown is bearing fruit even as the death toll rose by 345 to 2,503. Italians have been ordered to stay indoors, with schools and universities shut, shops closed except for grocery stores and pharmacies, and heavy restrictions on travel. Experts warn that there is a lag time between health measures being taken and their effects becoming conspicuous. That suggests the Italian lockdown imposed last week could now be starting to have a noticeable impact. Infectious disease and computer experts at the University of Genoa estimate the new daily infection cases will peak in Italy between March 23 and March 25. Italy's lockdown is due to end on March 25. Although schools and public institutions are set to remain closed until at least April 3. Reaching the peak doesn't mean you're in the clear, University of Genoa professor Giorgio Sestili cautioned. It only means that the epidemic has started to slow down and that, a few days later, you will have reached the saturation point of intensive care cases. The number of new infections in the last 4 days has been fairly stagnant with 3,497 on Saturday, 3,590 on Sunday, 3,233 on Monday and 3,526 on Tuesday. The percentage increase in cases has been below 20% for the last few days, falling to 12.6% yesterday. The signs of a slowing infection rate will be a relief to doctors on the front line of Italy's coronavirus outbreak, who have described catastrophic scenes in hospitals which are creaking with the sheer volume of cases. A new Oxford University study suggests that Italy may be particularly vulnerable because it has such an old population and the elderly come into frequent contact with the young. Italy's population is the second oldest in the world, behind only Japan. Oxford researchers said it was common for young adults in rural areas to live with their parents and grandparents but to commute into cities, such as Milan, to work and socialize. Young people may have been picking up the virus while traveling and brought it home without realizing they were ill, the Oxford researchers said. The study is another warning to Britain, which has an aging population. Older people are known to be more likely to die of COVID-19 if they are infected with the virus.